What is particular in terms of dilatation of dialysis access is that very often the lesions are more fibrotic in contrast with lesions we have, for example, in the periphery of the arterial system, and often you have to go higher on pressure. Also, what is important is that you are not necessarily looking for a completely parallel vessel wall at the end of a procedure rather than a functional and patent fistula, which really makes it different from dilatation of the arteries. The other also important feature is that while the rupture of the artery when you do dilatation is something that can be very problematic and might require open surgery or covered stent, in dialysis access, rupturing a fistula can be quite common, and if there is no additional draining vein stenosis, is very often well tolerated and can be treated with the prolonged inflation of the balloon. We had the opportunity recently to test ultra-high pressure balloon from Boston Scientific. The name of the balloon is Athletis, or Athletis, which in Greek means sportsman. And I was very happy to see that this balloon combines several favorable characteristics. It has a good profile and it is flexible enough, and at the same time it can go up to 40 atmosphere, which basically means that you can navigate in most locations like with a regular balloon, but when you have to go high in pressure and you have a heavy duty stenosis, you can use this balloon and you will be able to balloon most of fistula. Overall, we were quite satisfied, and I think it can definitely be a very useful addition for most practitioners that are dealing with vascular access that definitely need to have on the shelf an ultra-high pressure balloon if they want to be able to treat all kinds of stenosis. Finally, in terms of vessel preparation, we definitely know that for vascular access as well as for peripheral, vessel preparation is an absolute priority if you want to have good results in terms of stenting or in terms of application of drug-eluting technology. And essentially, we saw even in some recent randomized trials that quality and the level of pre-dilatation vessel preparation is of paramount importance for the successful application of any additional technology. Therefore, using an ultra-high pressure balloon that will reliably arrive in the location of the lesion that needs to be treated and appropriately preparing this balloon at the appropriate pressures that needed to be applied in order to treat this lesion are, in my opinion, key for the success of any additional treatment.